Hi, I'm Dr. Mark Rosenberg of HowToStretch.com. We're going to work a little bit on some different shoulder stretches right now. Many people have problems with rotator cuff issues, and that's when there's a tearing of the tissue in the shoulder that connects what's called your humerus into the shoulder socket. And just a little anatomy here. Your shoulder is an interesting joint. You have your clavicle here, and you have your scapula shoulder blade here. The upper arm, okay, actually sits in a socket made up by your shoulder blade. Okay, that's where it is. So it's held in place in the front by muscles, ligaments, and tendons. They get tight from driving, again, from working on the keyboard, from mousing, from sleeping, because our eyes and our activities, everything is in front of us. So we need to stretch out some of those muscles, sometimes a little differently, and these are some exercises you could do at a desk. So first, bring your arm up here. Now, sometimes the restriction is at the top of the shoulder in what's called the deltoid muscle. If that's the case, and this is as far as you can go, just hold it there. And this, again, as I reiterate in a lot of the videos, this may be the beginning stretch that you do for several weeks, just to hold it here, particularly if you're recovering from a shoulder injury. Okay, if you could do that next, place the hand on top of the other shoulder. Okay, and take a deep breath in. Exhale and push from the elbow back. Now don't let this arm go here, but have it go back behind you. Now what this does, I see people do this stretch, when they're going like this. This puts some tension in what's called the posterior deltoid. There are three deltoid muscles. There's the anterior, middle, and posterior. When you go like this, you're putting some tension, so it feels like there's more stretch, but part of it is because you're adding some tension to it. When you put the hand here, you're taking out the tension component, and when you go back this way, not only will you go back further, okay, you'll get a little deeper stretch closer to the scapula. Just take a deep breath in, exhale, and push back. So here I have my right hand up and I'm pushing back with my left hand. I'm not allowing my elbow to drop. I'm keeping it the same height as my shoulder. So inhale, exhale, push. Okay, then release, and let's do the other side. Again, pick the arm up. And again, for some people, I have a lot of patients and students that have come to me, they can't lift their arm. Just sometimes propping it up and holding it, watch, and relaxing into it is quite a bit of stretch for some people. And that may be where you're at for quite a while, a few weeks, a few months. It doesn't matter, you're working on it. It's going to get better. Don't get discouraged. Now, another thing I want to mention as well, you may have great flexibility in one shoulder and you can't move the other. That's not uncommon. People are right-handed. They play golf with their right hand. They open doors with their right hand. So with the shoulders, more than anything else, I expect more differences from side to side. So don't be discouraged if you discover that for yourself as well. So from here, if you can, bring your hand back over the shoulder. Take a deep breath in. Exhale. Now don't let the elbow drop, and push as you exhale. And it's funny, on the left side, I feel it more on what's called the posterior deltoid. On the right side, I feel it more in the middle deltoid. I'm right-handed. I work with my right hand all day. So I'm doing this, and I feel the differences just as I demonstrate them. Inhale. Exhale. And again, don't have your arm like this. Have it back. Then relax it out. Inhale, exhale. Let's do a little self-care here. Take your hand and grab hold of the deltoid muscle and massage it. And the deltoid is shaped like so, and it attaches here, okay? Rub. The upper part of your arm is called humerus. You want to rub all the way down to where the muscle attaches to that humerus. Now, in the front part here, you'll feel a bump, a bone. That's called the acromion process. That's what your bicep attaches to. Rub in there as well. And here you're using your thumb. That might be pretty sore. Okay, then do the other side. Okay, first we're going to massage the deltoid. And I bring my hand like this. And what that does, it allows me to cup the muscle and actually pull it a little bit. And I mentioned on other videos about adhesions. That's when muscles are stuck to each other, a little bit of scar tissue. If you just rub it this way, it can help a little bit. When you pull it away, when I actually squeeze, I'm actually pulling the muscle away. Sometimes there's an adhesion. You can pull it away a little bit. It's not going to pop or rip or anything. Just move it around a little bit. Then from here, take your thumb and find that bony protuberance called the acromion process and massage in there a little bit. Now, like I said, that's probably more sore because that's a muscle attachment for the pec muscles as well as the biceps. So that's often sore. And I'm more sore on my right than my left because I'm a righty. So, okay, now let's do the next stretch. Bring your arm up. And again, this may be a challenge for some people. Okay, so just bring it up bent. And again, if that's as far as you can go, that's fine. Now, people who have trouble raising their arms up sideways, one of the things you could do, and I'm not going to demonstrate here, is when you take a hot shower, put your hand on the side of the shower and let the water beat on that deltoid muscle. And then walk your hands up like the itsy bitsy spider a little bit. Now I'm doing it, okay, here. Okay, my arm's going to come up and I let the water beat here. And you'll be surprised, after doing that, after a few weeks, you'll actually get more range of motion here. In a small percentage, probably of the senior population, there's some calcification and bone growth in the shoulder that actually prevents you from going up too high. If that's the case, you could sit down in a comfortable chair next to another chair or a sofa that's a little higher. Place your arm on top of that and let it relax. And then you can put a pillow under that and bring it up a little higher, and a pillow under that, and that way you can stretch it as passively as you can. So that's a couple of workarounds. Walking up the wall in the shower and letting the hot water hit it, and sitting on a couch with pillows underneath your arm and raising it up. But if you've gotten this far and you're pretty comfortable, you can bring your hand behind your head, grab hold of the elbow and pull it over. And again, I'm not letting the arm go straight, it's down. And here I'm isolating, okay, a lot of these muscles in here as I pull. And I'm breathing. If you want to, at this point, you can even bend your body a little bit to get some of the deeper, the attachments, okay, for the latissimus muscle and also a muscle called serratus anterior. Okay, and let's do the other side. And astute watchers will notice that I'm not as stretched out on this side as the other, again, because I'm righty. I have an injury on my right side that I'm still recovering from a year and a half ago. And I feel those restrictions from time to time when I work a lot. Okay, and then you release. Okay, then roll your shoulders back a little bit to stretch those muscles. And then get in there and massage your deltoid muscles again. And keep in mind, if you do have a minor tear in there, if it's a major tear, don't do these exercises. You won't be able to. But if you have a minor tear, you may not even have had an MRI or diagnosed, and you do some of these exercises, getting an increased blood supply in there is going to enhance it. In fact, in many medical circles today, they're recommending that you do physical therapy for weeks before you do any type of surgical procedures. They're noticing that the recovery time is much quicker, and for many patients, the physical therapy first repairs the condition. They don't need the surgery. When you're doing individual exercise like this for joints, it's like doing your own form of physical therapy at home. You're rehabbing your body, and a lot of times you're rehabbing it before you even hurt yourself, which is even better. You can use these exercises as a comeback from injury, or you could use them to prevent you from having injury. Okay, that's today's stretch and exercises from howtostretch.com.